this? It's twice its normal size. It's a spleen, huge spleen. This person had a thrombocytopenic fibro, splenomegaly. I would say, yeah, this is great. Tremendous spleen. So you know what side is that?
Left side.
Left. So which way is this cadaver tilted? To the right or to the left?
To the left.
To show the spleen so well.
To the right.
It's tilted to the right. So what's over here?
Liver.
Liver. Huge. Which lobe of the liver is this?
Left.
50-50, pretty good odds.
Left.
It's the left lobe. The right's back here in the shadow because the cadaver's tilted to the right. So that's what I'm hoping you'll see in getting your orientation. That it's now tilted to the right, so the left shows really well. And it was actually done to get a little separation to show this structure. Between the left lobe of the liver and the spleen. What is it? Yeah, don't overthink it. It's stomach. Muscular pouch. There's the stomach. Because when it's laid flat, the left lobe sort of covers up the stomach. So the tilt gives you a perfect look at the stomach. This?
Greater omentum.
Greater omentum. Massive fatty apron coming off the greater curvature of the stomach. All right? How about this? What are you going to call that?
Falciform ligament.
Falciform ligament, you bet, coming out in between the lobes, heading for the anterior abdominal wall. So you haven't seen this specimen before, but you know the structures. So that's everything I would hope you would see in this different viewpoint. And even if you want, there's the diaphragm over the top. It actually extends like a cone. It's not like just a sheet, it's a cone of tissue between the thoracic and abdominal cavities. Try another one. This was prepared so that you could really see this. All attached into the posterior body wall.
Lesser omentum.
So you're seeing this, which is attached to this.
Mesentery.
What's this? Which is supporting all of this. What is it? Mesentery. This is all mesentery supporting the small intestine. And we shifted everything to one side so you can see underneath, all attaching into the posterior body wall. Could you tell me what this is? Be specific.
Sigmoid colon.
Well, you see this, which is going over to the right-hand side, attaching to this.
Ilium.
So what's this? Ilium. What do you have here?
ICV.
The ICJ. Iliocecal junction. And now here's the beginning of the large bowel in the lower right quadrant. Cecum. What are these? Haustra. Pouchiness. What would you call this? Ah, there's a longitudinal band on the surface, T. coli. Nicely demonstrated there. What's this? What are you gonna call that?
Gallbladder.
Gallbladder. It's peeking out from the right lobe of the liver. Right gallbladder. So I would only ask things that you're well acquainted with. Structures that you could still identify even though it's a different specimen. That's the whole point. That you can still identify many things even though you didn't learn precisely from that case line. Yes?
The small intestine, where in there is the duodenum ending?
Well, you don't have any keys here, especially for duodenum. The stomach's shifted out of the way. I would always want you to see the stomach to be able to identify the gross anatomy of the duodenum. So I would always make sure you have good things to give you reference from. The only reason I asked this one is because you had that point of reference, that you could see this going into this. Well, that's got to be the third part of the small intestine going into the colon, right? But yeah, other things, not so good. I would not antagonize you with tricky questions. It really would be inappropriate.
So the flexures or the hepatic and the transverse, they're just the terms, right?
Sure. A flexure means a bend. In the area of the liver, it's hepatic, in the area of the spleen, it's splenic. Which is not really shown here at all. Actually, this was also to try to get you to see this. It's actually hidden underneath the parietal peritoneum. It's got like a curtain over it. I'd say you're a real gross anatomy savant. If you could tell what that is. Ooh, that would be higher up, which you really don't see here at all.
Kidney?
It's the right kidney. Yep. This is the right kidney, which we'll get to in 2 weeks. First lap of the second component. And why we call it retroperitoneal, because it's underneath the parietal peritoneum, plastered against the posterior body wall. But I say that's not even anything to do with next week's material. All right, try another. Which compartment does this histological specimen come from?
Colon?
If you're organized, next week, you're thinking, okay, I've got 5 compartments. Esophagus, stomach, duodenum, ileum, colon. Now, which adds up to which compartment here? And so you sort of go through, do I see stratified squamous for esophagus? Do I see gastric pits and gastric glands for stomach? Do I see villi for small intestine? Brunner's glands for duodenum? Peyer's patches for ileum? Or Cripps goblet cells for colon? What fits? Someone already has it. All the bubbles. Gotta be
Colon.
colon. So you got Cripps, massive concentration of goblet cells. So yep, that's an easy one. And I might add, colon, and then I might, what are these?
Goblet cells.
The whole thing, crypt,
Crypt.
the cells within,
Goblet cells.
goblet cells. Really same structurally. Try another one. Where's this from? Well, I see these, which are,
Villi?
don't they look like fingers? Villi. So at the very least, you know, this is
Small intestine.
small intestine, right? Villi always equals small intestine. That's a quick one right there. You then take the next step, well, okay, is it duodenum or ileum? As you know, we took jejunum out of the picture. Well, the only way you'll be able to make that identification is if you're hallucinating. Because you're looking in the submucosa for Brunner's glands or Peyer's patches, neither of which is here. So you don't have enough to do anything more than call this small intestine. That's the right answer. Because you see villi, that's it. All right, so just identify it for what you see. Don't try to imagine or force the issue with something that's not there. I could ask you what this is. What would you call that?
Crypt.
Yeah, and this, and this, and this. These are crypts. So you still have crypts at the base of the fingers, right? So that's identifiable. What about the little opening on the villi? Goblet cells. What gives it the chainsaw look? So at 400 level histology, you start to use silhouettes to identify the three parts of the small bowel by the shape of the villi. And here, if it looks like a chainsaw, it's always ileum. But I'm going to let you say that for a few years when you get to 400 level. Silhouettes inappropriate for intro histology. And some interpretations. Or even just the density of goblet cells telling you it's ileum. But that's not part of your required histology. It's guessing at it. So for us, you see the villi, okay, small intestine, that's as far as you can go. So what if you gave like duodenum as your answer? Acceptable. So there would be 4 right answers for this slide. You could give small intestine, duodenum, jejunum, and ileum. Because it's just villi. I would have to accept all the others because they're parts of the small intestine. Even though technically you really can't be sure where it's from without structures in the submucosa showing. That's why I say many will do better than they think because there's usually more than one right answer. That I'm not really severe when it comes to exactly this has to be the right answer. Even saying I have to look at the papers first, in some cases decide what the right answers are going to be. You might see things a little differently than I did in setting up the questions. Say, oh, okay, that's acceptable. So then you'll do even better. Tissue.
Parotid.
So don't jump too quick. Take it all in.
Okay.
This is actually from